Hi, I'm Pat Taylor. I'm the Director of Health at iCare iMove, and this is your Menopause Muse Lunch and Learn. So today we're going to be covering fibroids, polyps, and some of the investigations that you might need to go through, and some of the treatments. And what are fibroids, polyps, etc., and what might they cause for you? So one of the symptoms of fibroids and polyps, one of the most common symptoms, is bleeding, heavy bleeding, or bleeding that is unusual for you. And if you're premenopausal, you might have really heavy periods. Periods that are unmanageable for you, or that are really, really unusual for you, and that needs to be looked into. And sometimes the polyps are found when they're looking into your fibroids. You might have some pain, some cramps, like when you were a teenager, and I used to get really achy legs and things, and when my fibroids were starting, I used to get those kind of pains and cramps, backache, etc. So what are fibroids? So we'll talk about fibroids first. So fibroids traditionally are non-cancerous growths inside the uterus in or around the uterus, and they can be within the wall, within the mucosa, and in various different places. And there's different types of fibroids, and we'll go through that later on. So the growths are made up of muscle and fibrous tissues, and they vary in size. Some people don't even know that they've got fibroids, and they can be small and they won't cause you any problems. Some people, however, they can develop and grow, and they can make the uterus bulky. They can cause heavy bleeding, and they can cause prolapses and things. So you need to get them seen to. And if they are causing problems, or you think you might have something going on that you're not sure about, then go and get seen. Ask about it, and you'll just, you'll be referred on, and you'll have some treatments and investigations. The other side effects are that if you have larger fibroids, they might start to press on your bladder, so you might need to pee a bit more often, or it might be you might have some discomfort. You might have constipation, or it might be painful when you're having sex too. So I didn't mean sex. So they're small growths, and they come from tissue that lines the uterus, which is the endometrium, and they can, like I said, they can range in size. So the most common side effect is irregular bleeding and sometimes spotting. So if you do experience that, get some help. And so what are the treatments for this? So what are the investigations first? We'll talk about investigations. So the first thing you might have is what they call a 2-week wait. Now that's quite scary, because a 2-week wait it's a fast track through the system, through the NHS system, to get you seen as quickly as possible. And quite often the consultant or the clinician will mention cancer, because it's a red flag. Bleeding in between periods or unexplained irregular bleeding can be a sign of cancer, but it doesn't mean that you have cancer. I try and look at it as it's a real positive, because I know that I'm going to get seen very quickly. I'll get a diagnosis and I'll get a treatment straight away. And you find out very quickly. The teams are really discreet, they're really empathetic, and they really look after you. So it's trying not to be scared about it, and talk to people about it, because it is worrying. So you have an ultrasound, you have to go with a full bladder, which is a bit uncomfortable when they're pressing around your bladder, and then you might need to have an internal scan, which again I wouldn't say it's uncomfortable. It's, if you're embarrassed, then it can be embarrassing, but the team are so discreet. Like I say, you're covered. It's in a dark room, so it's nothing to be afraid of. They'll measure the wall of your uterus, they'll measure fibroids, and they'll look for anything else that's kind of around there, make sure that your structure looks normal, and they'll report that. They'll report on the measurements, and you'll get a call back from your GP, or you might need to go and see your GP or the consultant again to discuss those findings. And it might be that they're quite small, and you just need some medication to help cope with the bleeding. So what are those? So there's things like something called tranexamic acid, or ibuprofen, the non-steroidal anti-inflammatories, which both reduce the flow. The tranexamic will help you to form clots, so that you don't bleed so much, but you lose clots. And the ibuprofen slows down the flow. There's all sorts of different medications as well. You can help with pain and discomfort. It means you need to kind of support yourself. It can be really embarrassing. So mentally, this problem can be really embarrassing because it means, you know, you have to look for a toilet all the time. You might need to wear pads. You might need to not wear white trousers. Think about your clothes. Think about where you're going, and it does impact your life. So be kind to yourself and let others know what you're going through so that they can make adjustments for you, especially in work. And I'll talk to you about that later when I was at work. And what can happen is, I'll talk to you about polyps as well. So polyps they can be called endometrial polyps, and they're small soft growths on the inside of the uterus or the womb, and they come from the tissue that lines the uterus. And they can cause irregular bleeding, spotting, but most polyps are asymptomatic. But if you do have bleeding or you're worried, then get it checked out. So polyps can be seen on the scans. The other scans you can have are called hysteroscopies. So a hysteroscopy is a very fine camera that is popped into the cervix and then into the uterus. You've got help. You're taken into a clinic and you're supported. You're given the information. It's a camera, and they can see quite detailed images of the lining of your uterus, and that's where most polyps are identified. And they can take biopsies there and then. And some people find it really okay. I didn't have a problem with them at all. I didn't need any painkillers. Some people have anxiety about it and may have a bit more pain, so you might need some support there. But you will be told about that. You'll have information leaflets. You're given time to discuss it with your consultant and the nurses when you go in. So what happens when you have fibroids and polyps is that you bleed quite heavily. So you might have iron deficiency or anemia. And they play out as being really tired, like fatigue, not just, oh, I'm a bit tired. Such fatigue that you need to sleep. You might be short of breath. You might have palpitations, for instance, and it can be easily treated with supplements, so folic acid, iron supplements, and diet plays a big part here. Eating your leafy greens, eating liver. I can't eat liver. So maybe pate, red meat, and supporting yourself with healthy foods, but also taking them with orange juice, for example, because vitamin C will help you to absorb the iron. When you're taking iron supplements, and as a nurse, I didn't realise this, you need to take iron supplements an hour or 2 hours away from tea, coffee, anything. And it's not the caffeine, it's the... It's gone out of my head. I can't remember what it's called. I'll come back to you. That's menopausal brain for you. Tannin. It's the tannin in the tea and coffee and hot chocolate, I think, as well, that stops you from absorbing it. And some foods, dairy foods. So, really think about when you're taking your iron so that you have the best outcome from taking it. It can upset your tummy sometimes, so bear with it. Once you start taking it and once you have the benefits in your body, you start to feel better. You're not so tired, you're not so breathless. You might not your brain fog might improve and you might sleep better and you bleed less, actually. That's one of the side effects if you have more iron, is that you bleed less. So can you see the links there? So I was going to go on to hysteroscopies. Can diagnose the fibroids, the polyps, and so what can you do about it? To remove fibroids, there are quite a few treatments, and some of them are non-invasive. So some of them are, they use radiofrequency, for example, to target the fibroids, and it's like a zap. So they zap them and they dissolve, and they just zap them so that they do dissolve and they come away. You can have an IUD, so a coil, that will help with the bleeding. It doesn't reduce the fibroids. And you can also have different treatments, which I won't go into, but some are ablations, some are treatments with the arteries to stop the flow to the fibroids. and polyps are usually removed. And you follow up, so you get a follow up from your GP. They will keep an eye on you, and it's really important then for you to just be really aware of your body, to write it down when you have your bleeds, when you have those intermittent bleedings, and don't be afraid to contact your GP. It's really important to be seen quickly, and then if it is something that they call kind of suspicious or sinister, then it can be treated early and the outcome is so much better. So my journey is that I was working in the NHS, and just bearing in mind that there are so many women in the NHS and you know are dealing with this kind of thing, and 1 in 4 women are likely or considering leaving their job because of menopause, because of the symptoms and how it makes them feel. So it's really important for women who are employed and not to just get this sorted and try to get the best help that you can. So my journey was, I was working in the NHS, I was a manager of the ward, it was a big unit, it was 54 beds, we had 80 staff, and it was a busy ward. I was trying to work in the office and I started to bleed. Luckily I had toilets, we had 2 offices and I had a toilet by each one, and I would just run to the toilet every day. Whenever I had a period. It was so heavy, I couldn't manage it. Then I left the NHS, not because of that, but I went to work for I Care I Move. I was delivering programmes out in the community, and again I had to leave the class, go to the toilet to sort myself out, to change pads, and at one point I couldn't leave the toilet because I was bleeding so heavily and I had to be seen. So my treatment was, I had a scan, it showed fibroids, and they decided to give me a coil, so I had a coil fitted. And then I started taking tranexamic acid, which was my saviour. It meant that I could carry on my day-to-day life without having to stay by a toilet. And then I started bleeding. I carried on bleeding, and that went on for 4 years, and I didn't really push it because I thought I had the coil, and I just thought, oh well, I'll deal with it. I then became really iron deficient, and I couldn't cope. I couldn't breathe. I was really short of breath. I had to lean forwards and take long, deep breaths. And they call it air hunger, and it's gasping for breath, and it's awful. And I was trying to walk up hills and I had to stop halfway. I felt like an old woman because I couldn't breathe. I was told that wasn't a symptom of my iron deficiency, but it is. It actually is. It's really, I felt really let down by the system, because I was constantly told you're not anemic. Your shortness of breath is not a side effect of it. But when I had symptoms again, I went and I was anemic. So it is, and you know your body better than anybody else. So listen to your body and just know that you should be empowered to be able to tell your story to your doctor and be listened to. So anyway, the outcome was I had another coil fitted because my coil wasn't there. Who knows where it went? So I then had another coil because I was still bleeding. I had more scans, external scans, internal scans. And then I was invited to go for a hysteroscopy to just see what was going on, because I was still bleeding. This was 6 years on. So imagine all that time wearing pads, bleeding constantly, feeling fatigued, brain fog. And you don't know if that's menopause or fibroids or what. So I went for a hysteroscopy, and they found polyps and 2 large fibroids, and no coil again. So that had come out again. So at least it wasn't in my left lung somewhere. So I had a scan. They measured my fibroids, and I went down the journey of seeing. I had an MRI, so to see where they were, how the blood flow was to them, and my possibilities were to have a uterine ablation, which means that they target the artery that feeds the fibroids, and they pass little tiny plastic beads into your artery, and it kills off the fibroids. And I wasn't keen, but anyway, the results came back, and I wasn't an ideal candidate because where my fibroids were, they could have pushed down through the cervix, and that wouldn't have been good news. You can have something called a myomectomy, which they described it to me, and I'm sorry if it's a bit too much information, like a Pac-Man. and they go in and they nibble away. So I was going to have that, and the other alternative was hysterectomy, which I really didn't want if I could manage it with the medication. And because I couldn't have a coil then, I was kind of like, oh, I'm not sure what I'm going to do. Anyway, I wasn't an ideal candidate. So I was looking at hysterectomy, but my period stopped. Yay. And I couldn't have been more grateful for that. So I didn't need to have a hysterectomy. I spoke to the consultant radiologist, who was absolutely fantastic. He spent half an hour on the phone with me explaining everything about, you know, if I started bleeding again, my options were that I could go and have the Pac-Man, the nibble, the MyoSure it's called, I think. There's new treatments out all the time. There's a new treatment called Sonata, and that was brought about from the USA, and they've just trialled it here, and it's really successful. And that's a non-invasive type of treatment which uses radiofrequency to target the fibroid tissues, and it's a day case. You're in and out in a couple of hours, and that has really good results. So there's lots of new treatments coming along. And so now, where am I now? I'm hoping that it's settled. I have intermittent bleeding, but my consultant said that actually fibroids can cause irritation in the uterus, so I might get intermittent bleeding. But I'm not to ignore it. You're not to ignore it. If you have intermittent bleeding that is not usual for you, then please get it seen to, because yes, it might be embarrassing for you. It's, you know, it can be awkward getting time off work, but you need to get it sorted so that you can be healthy and you can get it treated. It's manageable, and there's treatments out there and support out there for you. If you need support, if you need any advice, please feel free to contact us. info@icareimove.com, or you can look on our website www.icareimove.com, or you can call us, leave a message 0800 0541 118. You can call me, you can private message me, and I'll have a conversation with you. We can support you and we can help you with any information or education around it, or we can signpost you to the right people, and just be that. We'll be those people that listen to you and help to support you. So please do get in touch and let us know how you get on. Thank you and take care.